Hi Mo, what brings you here today?
So I know you all just recently diagnosed me with, I guess, menopause. And I'm kind of trying to wrap around my head what it actually entails.
Well, there's two types of menopause. There's perimenopause and the actual menopause. Perimenopause begins at the onset of your menopause symptoms, and it occurs through the sensation of your menses, and it's usually for more than 1 year. The average age, it begins from age 35 to 50, and it can last anywhere from 2 to 10 years, and it occurs because of a decrease in your estrogen levels. Menopause is a natural, normal part of a woman's life, and it's the transition to the part of her life where she's no longer able to have children, and it's also due to a decrease in estrogen levels. But what are some of your concerns?
Well, I mean, one, I'm only 40, so, the fact that I'm young and I only have one child, so that concerns me that I won't be able to have any more kids. How my husband's going to see me in that light and how attractive he's going to be to me now that my body's going to change. I've heard, little different things, and realizing how old I am now, and it's just progressing too rapidly. And my mom had a bad experience with menopause, and she had a lot of symptoms. And then I have my father, who's African descent, and I've heard that Africans tend to get it earlier. So I'm wondering if that's a cause of why I'm getting it at such a young age. I'm just not sure what my role is.
So Candace, I think that's something you can elaborate on.
These are all normal concerns that you're having. You just need to keep in mind that it's a natural process that every woman, goes through. Of course, the age will vary of when you're going to get menopause, but you're going to be different than what your mother or father relatives have been experiencing. So just keep in mind that, yeah, it predisposes you to what your family has had, their symptoms, but that doesn't necessarily mean that you're going to go through it. But some of the common symptoms to remember is that for sure you might experience hot flashes. You might have difficulty sleeping, and like you were saying earlier, you probably have a lower sex drive. It's normal. It's important to tell your husband about it and talk about it amongst yourselves, and also with us if you feel the need to. Besides that, food and diet, Kelsey's here to explain that.
Well, in menopause, the average weight gain is usually about 1 pound per year, but this can usually be prevented ahead of time, such as in cutting back in your calories, so that you can start losing weight as you get older. You want to lower your amount of calories because, one, you're decreasing your amount of activity as you get older, and you're gonna lose your lean muscle mass in your body. So you want to remember to have regular exercise, at least 30 minutes a day. You want to eat a diet that's low in saturated and trans fats, low in cholesterol, sodium, and also avoid added sugars as much as you can. And so that means focusing on eating vegetables, fruits, whole grains, lean meats, foods that are actually dense in nutrients. There's also some pharmacological and non-pharmacological approaches that you can use to help control your symptoms, which Alex?
So as Kelsey said, you can control your symptoms with nutrition, low-fat diet, exercise, which would be like good weight-bearing exercise because of the deficiency of estrogen, you are more prone to osteoporosis. So definitely try to do some weight-bearing exercises as well. You should reduce your intake of spicy foods as well, to say about the nutrition. Caffeine also, alcohol intake should be reduced. If you do smoke, you should think about, quitting. And some relaxation techniques also help a lot of people, such as yoga, meditation, acupuncture as well. We also look at the pharmacological way. So basically, if your symptoms are very severe, we do tailor the hormone therapy to you specifically. So it does definitely help you with joint pain, sleeplessness, your libido, your sexual drive. All of that would improve. And we would start with the lowest dose for as short time as possible. That way it can reduce some of the severity of its symptoms. So in the long term of hormone therapy, it can, decrease morbidity and mortality from heart disease and, cancer as well, and prevention of osteoporosis because you're prone to fractures would decrease with hormone therapy. So all of this you can take into consideration, as you said, you were just diagnosed. So these symptoms can occur try nutrition, exercise, try to do that first to see how you feel. And if in the long run, your symptoms get severe, we can definitely think about hormone therapy.
Okay.
Okay, so we can try to schedule to see you in a few weeks, see how you're feeling. If you have any symptoms, we can work with that, okay?
Sounds good.
Great.